Welcome to Sparks Catch Up with the Community Leaders, where every other Friday, the United Way of Greater Yankton Spark Connections for Community programs host conversations with community leaders from nonprofit service organizations with the hopes of catching up on the important work that our providers are doing within our community, and to also inform us of any upcoming initiatives or other events. My name is Todd Brandt. I'm a police commander and the president of United Way Sparks Connections for Community Executive Committee. Today we're meeting with Franny Kiefer, who is the executive director of Servant Hearts Clinic here in Yankton. Welcome, Franny. Thank you for being with us today. It's great to see you. How you been?
I've been doing well. It's great to be here. I'm excited for the opportunity to talk about Servant Hearts Clinic and thank Spark and United Way for this great opportunity.
Awesome, welcome. So before we catch up on a few things, at Servant Hearts Clinic, tell us a little bit about your mission, your history. How did you become involved in the Yankton community?
Yeah, so Servant Hearts Clinic started in 2012. There were 3 medical providers who had done mission work throughout the world, and they really saw the need in their own backyard. And they were like, if we're doing this in other countries, why can't we do this in Yankton? And so it kind of started from that kind of brainchild, and they opened in 2013. It was at our tech building, and it was kind of bare bones. They would set up and tear down every clinic night. And so it's really, to think about the burden to the volunteers, it's amazing to think about that happening. So in 2017, we were able to get a permanent location. And so we are downtown at the corner of 3rd and Capitol. And we have a permanent building. It used to be a dental office. So it's set up perfectly for a healthcare provider. And so we feel fortunate to be here. We are open every Monday now, kind of expanding those hours. Our mission is in the name of Jesus. We desire to serve the physical, emotional, and spiritual needs of all who come. And so anyone 18 and over is welcome to come. We don't ask for any financial information. We don't take any financial things from you. We don't ask for any ID. We are just here for anyone and everyone to come. You know, we realize in our community and the world, access to healthcare and the cost of healthcare is really a burden to a lot of our members of our community. And so we are here. All of our services are free that we provide. We also provide laboratory testing and prescription medications to our patients as well. And so some patients that come don't have insurance. Some do, and they just can't afford the deductible or the copay or have outstanding medical bills. And so no matter what your circumstances are, anyone and everyone is welcome to come to Servant Hearts Clinic.
Wonderful. Franny, you and your organization is truly an asset to our community, and it's fantastic that you guys are doing this for those in our community that struggle at times. So we appreciate everything that you do and your staff does to help the Yankton community. So, Franny, in the last 9 months, has there been anything that the Servant Hearts Clinic has been doing that you want to share with the Spark Nation?
Yeah, absolutely. I think with everyone in the community and all the other nonprofits and organizations, there have been challenges. Right away, when the pandemic hit in March, we decided to close, just with so many unknowns and the safety of our volunteers and patients. So we physically closed. We were still able to provide services to our established patients. And so we worked with our physicians. We were able to maintain some medications for those patients and also connect them to resources in the community. New patients who reached out to us, we again tried to refer them to different organizations, different healthcare facilities to get them the needs that they met. So even though we were physically closed, we were still serving our patients. And so the board, along with myself, we worked all summer and into the fall. We wanted to reopen, but what did it look like? We knew it was going to be completely different. Obviously, safety. The safety of everyone was what we were concerned about. The safety of our volunteers, our patients. What if they showed symptoms? What were we going to do? We didn't want to turn them away with no resources or anything like that. We were also concerned about our volunteer availability. Some people, didn't feel comfortable volunteering. And there already was a strain on the healthcare community. We didn't want to add, would us asking for volunteer hours add even more of a strain? Would we be benefiting everyone? And so we really talked through everything, and we were able to open in November with a great plan in place and some policies and procedures. It looks different than it did normally, but we've got some medical students volunteering with us. We do screening in the vehicle. So as soon as patients come, we screen them. And if they have symptoms, they kind of go of a different path. And so we have some free COVID testing that we offer through the state, which is great. We also give them kind of an education session as well. Okay, you have symptoms. This is what you should and shouldn't be doing. If your test is positive, what does that mean? But for patients who don't have symptoms, it's kind of business as usual. And so they come in and they are registered. A nurse sees them, our physician sees them. We also have a pastoral care volunteer that meets with them, just, can I pray with you? Can I pray for you? Can I connect you with someone in the community? And then the last person that our patients see is our discharge planner. And that is essentially our social worker. And so they really connect them with all the other resources in the community. Do you have food? Do you have a place to live? Do you have clothing? So all the other great nonprofits and partner agencies of United Way, we can connect our patients with them as well and get the services that they need. And so it's a great model to serve not only the physical, but all of the needs of our patients as well. So a little different. Masks are required, which pretty much everywhere anymore. So they're required, but we are seeing patients and our volunteers are here and willing to help. So every Monday night we are open at 5:30, first come, first serve, no appointments are needed. So yeah, we look forward to seeing all of our patients.
That's great, Franny. I just learned that you're not just about the medical side of things. So that's fantastic that you're providing them not only with their physical needs, but their other needs that everybody needs and sometimes faces challenges with. So again, thank you very much for all that you and your staff do for the community. Is there any other things that we should know about or that are coming up from Servant Hearts Clinic here in the future?
You kind of mentioned something there that triggered something. The other unique thing about our organization is that I'm the only employee and I'm part-time. All the services that we provide to our patients are from volunteers. And so most of our volunteers are in the healthcare field. They have their own professions and jobs and stuff. And so they come after hours and are willing to provide those services to people who need it. So it's a unique format, and it's pretty humbling to think about people going above and beyond to provide that for our patients. So we're open. So we're excited about that, to be open and providing services again.
That's outstanding. And yeah, the volunteerism from the professionals within your organization there, that's just amazing that there are those, and we're thankful for that in our community to have such a place for that. So I'd like to thank you again, Franny, for the Executive Director of the Servant Hearts Clinic, and thank you for taking your time out of your day to meet with us. And just thank you again for all that you and your organization do for our community. So
thank you.
Okay. Join us next time on Sparks Catch Up with the Community Leaders, where we'll be speaking with Stacy Starzl Hansen from the River City Domestic Violence Center. And make sure to follow Spark on your Facebook page or look for these recorded conversations on the United Way Greater Yankton's website at www.yanktonunitedway.org/spark. Have a great day, everyone, and stay connected.